ASRA, Center for Chest Diseases, Allergy and Sleep Disorders. We are located at D6 First Floor Shubham Enclave, Paschim Vihar, New Delhi. Facilities available are lung function test or PFT, diffusion study, bronchoscopy, allergy test, sleep studies, home sleep studies, spirometry, oximetry, lab investigations, and vaccinations. Lung function tests help a doctor diagnose respiratory diseases and disorders like asthma, COPD, and emphysema, and mechanical injury by measuring the degree of lung impairment. A gas diffusion study is one of a number of pulmonary function tests that help determine how well the lungs are functioning. Diffusion in this case refers to how well the alveoli or air sacs in the lungs are delivering oxygen to and removing carbon dioxide from the blood in the tiny blood vessels or capillaries that surround them. Bronchoscopy is a procedure in which a hollow, flexible tube called a bronchoscope is inserted into the airways through the nose or mouth to provide a view of the tracheobronchial tree. An allergy test evaluates the levels of allergic sensitivity to commonly encountered allergens, which may include foods, pollen, chemicals, or other substances in the environment. This can be done through a prick test or a patch test. Sleep studies are tests that record the body activity during sleep. They are helpful in identification of sleep disorders. Polysomnography, a type of sleep study, is the gold standard to rule out obstructive sleep apnea and is done frequently. Home sleep studies can also be done for the patient's convenience. Spirometry is the most common of the pulmonary or lung function tests. It measures lung function, specifically the amount or volume and speed or flow of air that can be inhaled and exhaled. Pulse oximetry is a non-invasive method for monitoring a person's oxygen saturation. Though its reading of the saturation is not always identical to the more desirable reading that one gets from arterial blood gas analysis, the two are correlated well enough that the safe, convenient, non-invasive, and inexpensive pulse oximetry is valuable for measuring oxygen saturation in clinical use. Lab investigations are an important tool to differentiate between clinical diagnosis. They also help in assisting the management and monitoring of patients. At ASRA, we provide lab investigation services through Quest Diagnostics Limited. Vaccination is to stimulate an individual's immune system to develop adaptive immunity to a pathogen. The most effective method of preventing infectious diseases is by vaccinations. It is the reason of elimination of diseases such as polio, measles, and tetanus from much of the world. We offer pneumococcal vaccination. Please consult the doctor regarding the same. FeNO or fractional exhaled nitric oxide aids in the assessment, management, and long term monitoring of asthma. The test immediately helps to detect airway inflammation in contrast to spirometry, which does not detect or measure airway inflammation itself. Thank you for choosing ASRA. You can reach us at 2525 9392 and 9871 120 522.